Шановні колеги, ми продовжуємо робочі.
We continue working day at Ukraine Crisis Media Center, and we are going to speak about seeking alternatives for repressive drug policy. Our speakers are Oleg Dzisyak, acting head of the State Drug Control Service of Ukraine, Albert Grasel, Chief Inspector at the Austrian Federal Ministry of Interior, and Dovbakh, Program Director, the European Harm Reduction Network, and Anton Basenko, specialist at the Alliance for Public Health, patient of the opioid substitution therapy Ukraine. Welcome on stage, dear guests. Dear journalists, we are very glad to speak about drug policy in Ukraine and in the whole European region and Asia. And I'm Anna Dovbakh, and we have 600 organizations that are involved in this. In all East European countries and Central Asia, there is problem of understanding of drug policy, and with the understanding how the state can reduce expenses for repression and to increase and change the attitude to drug addicts. And we will have 2 days of conference on reforms in the sphere and alternative to imprisonment for those people, and police in all the countries of the world has to carry out the function of help, and this is the basis. It's not only about police but also about medical workers and police workers and medical workers. They should help, but there are some achievements in the sphere. There is some cooperation between NGO and police to redirect patients to the sites of therapy and to help people to survive, to reduce the level of violence, and also we understand that there are some good examples, and we are speaking about the strategies and how we can help each other. We have 70 participants from 14 countries of the world, so law enforcers are represented, and also the Department of Drug Control activists and NGOs are present also, and we elaborate the steps to harmonize drug policy, and in order not to frighten the user, but to provide the opportunity to any addicts, and they are present in all societies, to give these people opportunity to overcome difficult situations and to protect their rights. And now I give the floor to Oleg Dzisyak, acting head of the State Drug Control Service of Ukraine, and we happy that he supports our policy, and thank you very much. I greet everyone, and our country as of today have state policy in the form of strategy till 2020, and according to the estimates of experts, this is it is one of 10 best policies in the sphere in the world, so we can be proud of it. So the principles were established due to cooperation with civil society, international organizations, and also taking into account the experience of leading scientists and the results of their work. Also, we worked at the 30th session of UNO on drugs, and this is a world problem, and the problem with drugs that each civilized country, despite its traditions and culture, all the states should be involved in resolving these issues, and it doesn't mean that, for example, in some countries these drugs are produced, other countries they are like transit routes, and others that consume these drugs. So every country should fight against abuse in the sphere, and we should defend the rights of people. We should fight the substances, not people. And on the example of our neighbors, we see that if we focus our policy not on people but on drugs, it leads to bad consequences. That's why all drug policy in the world is redirected. We try to remove repressive methods that were directed against drug users, and we should focus our effort to fight crime in drug industry, because this is well-developed network, and we should cooperate in order to fight this evil. And we should not find compromises with this crime industry. And there are some principles of conventions that were ratified by Ukraine, and our strategy is built on these principles. These are the principles of accessibility to treatment for every person, absence of discrimination, access to painkillers, painkillers that contain some drugs, and also well-balanced approach, accessibility and control. And sometimes control brings more problems than it should, and we should carry out our activities in civilized manner, and we have positive results of this program. And this is therapy for people, and we see that there is reduction of harm connected with weapons and improvement in situation in connected with some offenses. And this is a voluntary program, and each state should provide the opportunity for the citizens to realize their right to health and life. And the therapy provided during this time showed that from one side we will be able to help people to be participant of this program and to improve state of health, and also there should be some so they replace one drug for another, and they try to support the health of person, and a person can be an active participant and can lead normal life. And for state body, it is important to control the situation, and that is really important. Of course, we may say a lot about medical issues, but we will leave this for doctors. And this program works in the world. That's why the state should provide people with opportunity to take part in this program and to provide its realization.
Although currently we direct our policy upon review of so-called repressive methods or measures applied to the drug addicts, and a drug addict is dependent on the drugs, and when such people commit crimes, they also are and there are victims when they commit crimes using drugs, they are victims of the drug trafficking and drug abuse, and thus the law enforcers in this case should not just look for drug addicts. They should look for those who are who deliver these drug addicts, who supply them to such vulnerable people. And I think we should focus more attention on prevention of drug trafficking and drug illegal delivery to such people. Also, when law enforcers assign the commission of criminal deed depending on the dose of drugs in the blood of such person, and those norms which are used by law enforcers, they are very old. They should not be used for filing criminal cases. On the other hand, our penitentiary system also is unable to cope with this huge number of criminal cases which are classified in line with that medical norms. And actually this just postpones the punishment. In Ukraine, we do not have a criminal responsibility for the use of drugs, but we have criminal responsibility for storage of small amounts, and instead of looking for real criminals who really do drug trafficking and make people victims of the drug abuse, we persecute and find those people who are actually victims. Thank you very much. Now I would like to give the floor to a person representing Austria who will describe how it is important to provide a full amount of medical services related to the drug addiction to people who are detained with law enforcers and remain in jail. That's why we invited the representative of the Austrian Ministry of the Internal Affairs and representative from the Austrian civil society organization to describe how they tackle this problem. I'm pleased to give the floor to Mr. Albert Grasel from the Ministry of Foreign Affairs of Austrian Republic. Ladies and gentlemen, I'm happy to participate in the conference and describe our experience from Austria. I had a possibility to welcome participants of the conference in Vienna. And that's why we were very happy to present our standard here to our colleagues. I was happy to hear and very much impressed by the happy to see and very much impressed by the huge interest which we attracted from the state bodies and from civil society organizations. I've been working for the Directorate General of the Common Order of in the Ministry of Law Enforcement of the Interior of Austria, and we have all the responsibility to take care about people who deal with drugs. On the one hand, we are responsible for prevention from drug abuse. That is, we have to prevent dependence on drugs. And in this area, we make main emphasis on work in the youth communities and in the work and on the work with the criminal community. The second direction of our responsibility of our work, those drug addicts who are detained by police, they are immediately provided with special support. From the moment when such a criminal is detained, representatives of civil society organizations are provided with access to this person, and later on they will contact with this person when he or she will be released. All the medical services supplied by police and by civil society organizations, they are free of charge for the patient. Of course, in this area we work in this area very closely with the Ministry of Healthcare and Ministry of Justice. And especially I would like to mention our primary partner, the Dialogue Civil Society Organization, and I'm happy to represent my colleague from this organization to you today. During the conference here, we understood that there is a need in our support to Ukrainian party. It is necessary to create some partnership with the countries who participated in the conference. the conference allowed us to get familiarized about the activities of our colleagues, and today, after lunch, we will continue our joint work. Also, I would like to present to you my colleague, medical leader of the civil society organization, The Dialogue, and he is Dr. Walter Arnold. And he will represent their activities, and then we will answer your questions. If you will further have questions, we have a representative of the Ministry of Interior from Austria who will answer the question. Ladies and gentlemen, I'm also happy to thank you for invitation to this very interesting conference. I am Walter Nord. I'm a psychiatrist, and I represent one NGO. Our NGO is called The Dialogue, and is the biggest medical center of assistance for drug addict people. For 16 years already, we have been working with police very closely, and we jointly work in 2 police centers of temporary imprisonment, which we have in Vienna. As a psychiatrist, I would like to say a couple of words on drug addiction. From medical point of view, the drug addicts are those people who are psychiatric patients, and they are ill. The majority of those people have some accompanying psychiatric diagnosis, and unfortunately they also have some infection disease due to drug addiction, like due to use of drugs like hepatitis C or something like that. That's why these people, first of all, require medical support and medical supervision, but not imprisonment. At the same time, many substances are prohibited in Austria, storage and transportation and the use of them and transfer of them could be criminalized. But for those people who are detained by police, should get quality and sustainable medical care and medical services. As I have already mentioned, for 16 years now, we have been using this model of cooperation between our organization and the police. The sense of activities of the police, and in jail they are opposite, of course. But nevertheless, after some phase of counteraction, we nevertheless found the joint field for our activity, joint ground for our activity. And after all these years of experience, we can make conclusion that both police and our civil society organization are satisfied with the results of our work, and we work for the benefit of those people who got into our sphere of responsibility. This is not the single experience which we study, but what is important for us, it is that punishment of the drug addiction result in more expensive outcomes for the country and society. The example of Austria and Netherlands encourages us to change our approach. I cannot speak about illnesses or diagnoses. I can only say that a person receiving the substitutive therapy is the human being absolutely with absolutely the same rights as other citizens to life, to work, to happiness. With this, I would like to invite to the microphone Anton Basenko, who is familiar with the lives of people who are drug addicts and who knows about drug addiction, and who can speak about the most important aspects of this issue and why it is important. I have a unique opportunity to speak in my two capacities, from in a capacity of the leader of an organization which for many years has been dealing with substitution therapies. The last year we covered 212,000 drug addicts with our drug substitution therapy, and during the years of our work we managed to decrease considerably the pace of HIV spread. I used to be one of the patients of the substitute therapy in Ukraine for 11 years, and I have an experience of using drugs and drug substitutive therapy. These people who had 8.5 thousand people came back to family life, came back to health, to full-fledged social life. Unfortunately, Ukraine managed to implement this program of substitution therapy only in a voluntary way. only for those who voluntarily come to these services, and we do not manage to introduce this system in the penitentiary institutions. I believe that this situation should be changed. The substitution therapy patients might be 800 people more, because actually almost 806 patients remained with this without substitution therapy 2 years ago, and as of today 100 of them died. I do not think that those programs should not become the subject of political plays of politicians, because there are lives of people standing behind those programs. As an expert in this area, I am very much concerned with the fact that these programs are currently implemented on the account of international organizations, which will last till mid next year. And as of today, Ukraine has not announced about its support for this program and for about its political responsibility for all those people. And now I'm very much concerned about the future of all those people. Currently, Ukraine remains in a unique situation when we try to carry out a lot of reforms, and I think that this is the right moment to tackle the problem of drug addicts, and to redesign our drug addict policy. I think now it's important to redesign the state policy and to ensure the future for these good policies which we have as of today. Thank you, dear friends, dear journalists. Do you have any questions? I'm Maria Zavyalova, Громадське радіо. I have a question to Mr. Dzisyak. How do you assess the current struggle of law enforcers with drug abuse and drug trafficking in the country? I think that any work of the law enforcement agencies should be assessed against the real diminishing of the drug delivery and drug sales in the country. I think that if government official makes some statements, he should know what he means. Personally, as for me, I can refer to the state documents passed by the Cabinet of Ministers of Ukraine, which approved our activity and made its decision about supportive therapy, substitution therapy for drug addicts. And I believe that instead of persecuting the victims of the drug abuse who became drug addicts, the law enforcers should tackle the problem of drug trafficking business. We definitely know that when the law enforcers accuse just the drug users, drug addicts. This means for storage of a small amount of the substances. This suggests that probably the major amount of illegal substances remained beyond attention of the law enforcers, and that they have not reached the source of illegal trafficking with drugs. They have not reached the shadow money circulating in that criminal business. We should focus our attention on the healthcare services. We should support such people, and the police should inform our citizens about human attitude towards drug addicts, and this will be for the benefit of our society. Whether you provide any difference between heavy drugs, light drugs, or whether you make any difference between actions that make huge harm or light harm to the person's. Ukraine signed the international convention, which provides a very detailed table of the substances which are classified in line with the harm which they commit for the health. Like there are fully prohibited substances, there are substances with restricted circulation, etc. But the idea is that the drugs should be used for medical purposes exclusively, and if there is any uncontrolled use of drugs, then this is illegal action. There is no definition between light and heavy drugs. Actually, in each country, there is a different approach in each country. In some countries, currently the issue about legalization of, as you called it, light drugs is discussed, but I can assure you that even the light drugs make harm to the health, and the use of drugs should be allowed in line with the international convention in medical purposes, in scientific purposes, and in research purposes, and all the rest is prohibited at the international level. And when I hear today that some review is needed as to the review of some substances like cannabis-related drugs. And I heard several reports on this issue. Nevertheless, position of Ukrainian state is as follows. All the drug substances should be under the supervision of the state. What we should allow is to use medical substances like drugs for medical purposes. What we should guarantee as a state, we should guarantee that Ukrainian citizens could use cannabis-related substances for treatment of Nazarисов soon політична критика. I think that all the policies which were developed by 2013 experienced huge impact of work conditions in the East. How did your policy change after beginning of the war? Thank you for this question. The war changed access to the pain relief drugs. And in Ukraine, all the substances of pain relief drugs are imported drugs, except pyramidol, which is produced in Severodonetsk. This is a synthetic substance, but morphine, which is used in this in its formula, is imported from abroad. As for the level of sufficient provision to the patients, jointly with the members of parliament, we recently reviewed the use of these substances in we change the access to them for rescue services, for rescue teams, for medical teams working in the conflict area. And we attend the contact line and also conduct public awareness campaign. We also supervise the licenses for production of such drugs. And of course, this brought us to the review of the legislation. We also should mobilize our forces. We also should cultivate the poppies and other plants in Ukraine to produce cannabis similar substances here in Ukraine. In Ukraine, we have the lowest level of supply of morphine, which is a strong pain relief substance. So either we suffer, either our patients suffer on pain or they are supplied with illegal drugs. So we have to provide our local producers with our locally produced substances. Thank you very much.